am Dr. Jolly Thomson. I focus on clinically supported lifestyle correction for treating chronic lifestyle diseases. Here I would like to share my professional experience with this approach. This series is about my experience with the patients who took clinically supported lifestyle correction to avoid surgery and reduce and stop medication. This can help you understand how valuable are the lifestyle corrections needed for overcoming any chronic lifestyle disease. Most importantly, what advantages such an approach has when deciding on surgical procedures or continuing with lifelong medications. Here we can learn of the approach for a patient who had hypertension for the last 16 years, diabetes for the last 13 years, coronary vascular disease for the last 2 years, now TMT positive, angiogram shows 3 vessel disease, atherosclerosis of the and calcified plaque right subclavian artery also is there, and he is having osteoarthritis of the knee. Gastric problems are there, especially constipation is troubling him, a fatty liver, and he is on almost 16 types of medicine and on insulin twice a day, who in spite of all these medications was advised to undergo coronary artery bypass surgery. Here I will try to explain how the surgery could be avoided, how long it took for multiple medicines to be reduced and stopped, how long it took to get relief from symptoms and progress evaluation based on corresponding improvements in periodic tests. When we come to the details of the patient, this is a male, 175 centimeter height, weight 94 kg. His age is 58, but his body age is 66. That is, accelerated body aging is there. His abdominal circumference is 108. Fat percentage is 29.9%. He's been diagnosed on taking medication for hypertension for the last 16 years, diabetes 13 years, and is a non-coronary artery heart patient for the last 2 years. And recently his TMT is positive and an angiogram is done. It showed a 3 vessel disease, that is all 3 vessels are having block, and advised bypass surgery. And along with that he is having a calcified plaque on the right subclavian artery also. He is having pain on the right arm. For that, when we investigated that subclavian, that artery supplying the right hand also having reasonable blocker there. And he is suffering from osteoarthritis of the knee joints also. And the orthopedician has advised for a future at least to consider knee replacement also. He is having gastrointestinal problems, especially constipation, and also some gastrouble also is there. And he is having a fatty liver also. When we consider the disease category, it's mainly of metabolic nature, that is metabolic syndrome, actually hypertension, diabetes, atherosclerosis, osteoarthritis. That is because of this obesity, that is osteoarthritis, and degenerative diseases are setting. When we look into the medications, he is taking 13 medicines actually. That is actually twice Degludec, insulin Degludec is taking 10 units morning and 15 units evening. Dapanom, that is for the dapagliflozin, that is 10 milligram he is taking. And Sucanum, that is actually a combination medicine of metformin and bedagliptin, that is taking. Then PPG Met, that is metformin plus oglibos tablets twice he is taking, and glimepiride, that also twice. So many medicines for the diabetes itself. And then yellow with maybe vitamin K, cyst, sildenafil, also. It's maybe having some sexual dysfunction also. These are the current prescription, when we start on the day 1 prescription actually. Next is the investigations actually. When we started on the day 1, or we can say day 0 or day 1, that means before starting lifestyle modulation or clinically supported lifestyle correction, we do a detailed investigations actually. So his HbA1c is 7.2 in spite of all these medicines. His insulin level is very high, that is 118.2. That means there is insulin resistance is there. Otherwise also type 2 diabetes is insulin resistance is there. With this cholesterol medicines and all, he is under control actually. Cholesterol, but triglyceride is high, but HDL is low. And his GFR also is decreasing, 77 only. And sodium level, electrolyte imbalance also there. And vitamin D also is low. But his cardiac markers, troponin I and HSCRP, CRP is normal. So when we start clinically supported lifestyle correction, it is actually his diet is, because his obesity also is there, we try to adjust he's getting all the nutrient in correct proportion, around 650 to 700 calories. But all the nutrition should be is there in the correct proportion, especially with a very high amount of omega-3 fat, but with the balancing the omega-3/6 ratio around 1:1. And an exercise pattern, which can be even for the patients, whatever disease is there, if it is reasonably okay, can be done sort of exercise that can be done in a lying down position or sitting up position. With that, after starting on the 8th day, actually we check the patient initially on the 8th day. This program itself is divided and in a staged manner it is taught also. So after first visit, again come on 2nd, 8th day. By the time he was actually reduced on all the diabetic medicines are for a type 2 diabetic patient, all the diabetic patients are diabetic medicines are reduced on the stopped on the first day itself, and he can specifically made a low calorie diet, and also some low calorie food like leafy vegetables and fish or meat, especially is diabetic, low carb diet also, natural food also the patient can take. And on the 8th day, by the time, so the first day itself, the patient's diabetic medicines is over. So the total 13 medicines, it is reduced to 4 tablets actually. And initially for the diabetic patients, especially on this much of diabetic medicines and all, 4 times the patient has to check the blood sugar at home itself and record it, and this monitoring is done through the as a telemedicine part, and if give directions as a telemedicine. And the first day, the 8th day when he comes, there is only 4 medicines. When he comes to the 8th day for the checkup, his main symptoms were knee pain, tiredness, and exertional dyspnea, especially when you climb stairs or walking fast. The chest discomfort is coming, or breathlessness sort of feeling, and constipation. That was his major symptoms. And on 8th day when he come, he's saying that his knee pain and all is around 50% reduction is there, tiredness around 80% reduction, and exertional dyspnea sort of problem also 80% is reduced. And his HbA1c is reduced from 7.2 to 6.6. See, without after stopping, usually we say that HbA1c is checked every 3 months for an average and all. But for a clinically supported lifestyle correction, we check it frequently in the initial stage every week, and also after for 2nd month onwards every month. And if the patient is not properly controlling, every week we can control. But this patient is 8th day itself, it is 0.8 reduction is 0.6 reduction is there. On 15th day, actually his HbA1c comes down to 6.2, and 30th day it is 6, and 60th day it is 5.8, and 90th day it is 5.6. So this is a very nice patient actually. So he follows everything in the correct manner. So the HbA1c change is very systematic and in the order. And his insulin level also came down to on the 8th day we don't usually check the insulin level. Usually on the 15th day, the insulin level, it was 118 when we started, and it came down to 8 on the 15th day. And again, we checked again on 60th day, the insulin is 4.6. That is the different in the changes. And also the cholesterol, the other medications, actually other medications, and calaptin for, that's a verapamil, that is a calcium channel blocker for the BP. Amylodac, amlodipine, actually that is also for BP. Acertor 20 milligram he was taking, that is for the cholesterol. And Diplate, that is aspirin and clopidogrel. All these medicines were over by 30 days. His BP was 140/100 with the medicines. Actually, he is taking 2 medicines for BP. But on the 8th day itself, BP has come down to 130/80. And by 30th day, all the BP medicines was over, and the BP was 120/70. Actually, the BP we are recording in the hospital, that is always little high because they are traveling, and the tension level will be usually some white coat stress will be there. So slightly higher in the at the hospital recording, and his at home recording was usually around 170, 170. That was the at the home recording actually. And also initially when we checked sodium level was low, but it was by the 15th day sodium level has corrected, and GFR, the kidney function, was gone down to 77 when we checked initially, and the GFR came to 88 in day 90. And the initially HDL was low, but the HDL also was gradually corrected by day 90. HDL correction, some of these parameters correction may, but parameters correction may take some time. But usually, and we don't try to bring down the triglyceride. Triglyceride definitely below 150 is the ideal. But total cholesterol, we don't try to bring down to 150 and around 200 will be okay. Even around little higher, up to 250 also. If all the other TG and HDL level is okay, there is nothing to worry about with all the parameters, just the cholesterol, because cholesterol is an essential, because the time the rebuilding of the body and repair of the body is taking place for the cells, new cell development, and cholesterol is needed. So we don't try to reduce the cholesterol level to very low level. When we summarize, what is the benefit of this approach compared to the conventional means? He's able to become symptom-free within 2 to 3 weeks itself. And he is able to avoid surgery, a bypass surgery and a knee replacement surgery in the future. Immediately he has asked for a bypass surgery. And even if we do bypass surgery, your pressure and cholesterol and all, pressure, cholesterol, or diabetes won't go off. Here he's free of diabetes, free of hypertension, free of all the medicines also. But if he undergo the surgery also, he has to continue all this medicine to till the end of the life, actually. That is the no. And definitely after the surgery, when they take rest, or after bypass surgery, there is 3 months. Anyway, the mobility and also will be reduced. Then there is a chance for increased weight gain also. So it will aggravate his osteoarthritis, and he has to go for a naturally after some time, and a replacement will be needed. Then actually he was on 16 tablets, remember, and twice insulin also. That is over by, all the medicines is over by 30 days. When we consider the blood report, HbA1c decreased from 7.2 with the medicines to 5.6 without medicine and insulin. Almost 7 tablets and 2 injections of insulin every day. The reduction is from 7.2 to 5.6 happened in 90 days. And when we come to the body parameters, BP with the medicine was 140, 100. That is 2 tablets were taking, that one twice a day and all. But without, after stopping, within 30 days, the BP has stabilized in 120, 80, 110, 70 and all. And his body weight actually, he was 94 kg. He came down to 79 kg in 90 days. And his abdominal circumference come down from 108 to 85 centimeters in 90 days. And his age, actually his age was 58 only. But he has accelerated aging and his body age was 66. That is almost 8 years he was older than what his real age is. That came down to 56 actually. That is now after 90 days, he was a person who was really 58 and body was more raised to 66, come down to 56. That is 2 years younger than what is real self. Now that is actually reverse aging, 10 years in 90 days actually. We can reverse an accelerated aging. What is expected in the future actually to improve and maintain blood parameters and body parameters, that is this HbA1c and all should be little more improved. 5 point, I think 6, we can even come under, it has to be maintained below 5.6 actually. And he should maintain his body weight around 65 kg. And fat percentage, ideally, it should be around 10 to 15. But at this age, at least below 20. And body age, anyway, now itself he has come down to 2 years lower than that. But if he increase, if he continue his effort for another 3 months, usually this clinically supported lifestyle correction monitoring is given for the initial is 90 days is the first month is the intense monitoring till the medicines are over, then 90 days, then the next landmark is 180 days. By 180 days to bring the body composition to optimal level. That is what we are intending actually. If you bring down your body composition to optimal level, all the parameters will be corrected. And maintained not only in the macro level in the weight alone, this actually that omega-3,6 fat actually, that are the controllers of our immune system and almost all the functions. Actually, this omega-3 and omega-6 fatty acids are controlling our system. So the omega-3,6 balance also bring down to normal, not optimal level. That is actually 1:1 ratio. If you are able to do that, this all the parameters will come down. And it is so fast, you can see the result. You cannot, any medicines can give such result. That is because if you are medicine, he's taking these medicines for so many years, but it is not giving him any cure. That is the difference. Actually, the patient has to take effort to bring modulate his lifestyle and bring the body parameters macro level and micro level to the optimal level. Here, in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting removal of toxins by improving circulation through optimal stimulation of all cells by planned exercise. Third, minimizing toxins entering the body through food, water, air, and cosmetics. Diabetes, hypertension, heart disease, liver disease, kidney disease, obesity, stroke, allergies, autoimmune disease, and cancer come under the umbrella of lifestyle diseases. 90% of the medications and 90% of the surgeries are for lifestyle diseases. This means that 90% of medicines and 90% of surgeries can be avoided. In the case of any lifestyle disease, the best treatment begins with the first step of diagnosing the underlying faults in lifestyle. That is the cause of the disease. Next is corrective measures to rectify the damages and overcome both the disease and the need for continuing medications and surgical interventions. It is good to understand that Neither medicines nor surgery can cure a disease. To put it differently, it is not a lack of medication or surgery that created the disease in the first place. This is why once medication is started, it becomes a part of the disease for life. Very often, both the disease and medicines will keep on adding more numbers along with the unwanted side effects with no hope to return to a healthy status, which not only affects the patient but also the dependents and caretakers. This is why it is very important for you to understand and correct lifestyle while also encouraging others to do so. Another important aspect is when someone is talking about healthcare and treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kottayam as 1981 batch and completed diploma and MD in obstetrics and gynecology from Government Medical College, Tirunelveli, Kerala, India in 1992. After additional training in reproductive medicine, surgery, and painless labor, I joined government service. Later resigned from government service and in 1997 started practicing as consultant at Lifecare Center, Tevara, Kochi. I focus on lifestyle moderation with the clinical support for lifestyle diseases, minimizing need for medication and surgery. I would like to bring to your attention how the major part of the medications we take are excreted in urine, sweat, and stool. It will reach the groundwater, rivers, drinking water, plants, animals, and food products. That means the medications we take is becoming a threat not only to us humans but to all the life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle diseases, and come out of medications. To protect our children, grandchildren, and the coming generations from the ill effects of toxic pharmaceutical pollution, we should come out of the dependence on medication. The current norm of chronic patients on lifelong medications has to change. Spreading awareness on optimizing and minimizing medication is the need of the hour. We believe the informed patient is the key to treatment success. You can find detailed content on different diseases, their treatment with the emphasis on benefits of lifestyle correction from the website and YouTube playlist. The videos are prepared to understand more about the disease, the possible underlying cause, early diagnosis by understanding the symptoms, current diagnostic methods and treatments, along with the benefits and side effects, practical aspects of the lifestyle, self-correction, and for those who may require clinically supported and supervised lifestyle correction. When a patient is having more than one diseases and there are too many diagnostic and treatment modalities with many side effects, awareness of the benefits and problems of different diagnostic, medical, and surgical interventions is the key to regain your health. Better informed patients take better decisions and live longer, healthier, happier lives. Thank you.